never been to a chiropractor before, you might be wondering what that looks like, or maybe you're just curious about the techniques that we use at our office. My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley, and today I'm going to demonstrate some of the treatments I might choose to use on a person suffering from low back pain. Now, if you've seen our low back pain detective series about thorough history and exam, you know that first we ask a lot of questions in the history, trying to figure out the source of your problem. Then the examination allows us to narrow down what's going on, find the source of your problem and the cause of your pain. Then that allows us to make some decisions about what treatment techniques are the best for you. So one technique that I might choose to use is the impulse adjusting tool. So this is an excellent tool for someone who's in a lot of pain, maybe someone who has some nerve pain, or someone who has a lower bone density. It gives a series of taps to the spine and allows us to be specific about where we are going to adjust. So on this patient, I know that upon examination they were sore on one side of the spine. That series of taps also allows the muscles to relax in that area. We also like to address any tension in the muscles or muscles that might be pulling on the spine, contributing to your pain. Both myself and Dr. Freedman are trained in a muscle technique called active release, or ART, and this involves movement or stretching of the muscles while we pin the muscle. So for instance, in the low back, we might want to address the erector spinae muscle that run up and down the back. And while I press here, then the patient moves their leg up and down. So I'm pinning the muscle and we're stretching it at the same time. Now when it comes to the spine, this also allows me to do a bit of what we call mobilization, get some movement in specific parts of the spine. We might also work on some of the muscles that attach into the hip. So on this patient, we know that their hip flexors, their psoas muscle at the front of their hip, was tight, and that can pull and compress on people who have low back pain. So in that case, we bring the leg backwards while I press on the muscles at the front of the thigh. We can do this on many different muscles that attach into the low back and on different parts of the body. If we've decided that you're a candidate for spinal manipulation or what we call adjustments, then for the low back, we would position you on your side. We'd roll you a little bit, add a little bit of a thrust, and then we might hear a pop or a crack. Now, that cracking sound is not actually bone on bone. All that sound is gas bubbles popping inside the little capsule that surrounds the joint. For some people, I might choose to also use the table. So different parts of the table pop up and then they drop out. So on someone who maybe I need a bit of a stronger thrust, or on someone who I want to be able to control the thrust and actually do it a little bit lighter, I might choose to use the drop piece. Now, these are just some of the techniques that we use inside the office. We are going to ask you to do a little bit of homework outside of the office, and that's just as important. So at the beginning, you might be in a lot of pain, so we'll give you some exercises that focus on pain-relieving postures. And then we might start to add some stretching that stretches some of the muscles attaching into the spine so that they're not pulling or compressing the spine. And then we want to think about strengthening, building you back up so that you're more resilient and your back pain is less likely to return. All the decisions we make about treatment are individualized, so they're based on your past history, your current health history, your age, your physical condition, and based on also your preference. So every treatment is going to look a little bit different based on the person in front of us. We post regular content as Willowbrook Chiropractic on Instagram, Facebook, and YouTube on a weekly basis. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.